Just a reminder, 12 young, fit, healthy young people die of an unknown heart condition. That means by the time we get to Christmas, that will be 20 young people who've lost their lives. By this time next year, that will be 600 people. All of those, Madam Deputy Speaker, could have been prevented. I was first aware of the scale of this tragedy when I bumped into an old school friend for his 40th birthday, was fundraising for the Brilliant Cardiac Risk in Young People, or CRY. Unbeknownst to me, he'd lost his brother to a sudden cardiac arrest when we were just in our teens. The second time I came across CRY, it was much closer to home. My niece's boyfriend sadly passed away in his sleep 3 years ago, fit and healthy, having gone on a run only earlier that day. His mother, Leslie, and my niece, Izzy, have been steadfast in their campaigning for CRY ever since. So what are CRY all about? They do vital work in raising awareness, supporting bereaved families, and most importantly, screening young people. CRY offers ECGs, cardiograms, screening to all young people between the ages of 14 to 35. To date, they've screened over 340,000 young people since their formation 30 years ago. I was lucky enough to see one of their screening days firsthand at Cambridge University Sports Centre, organised by Hilary Nichols, who've already been mentioned this evening, in memory of her daughter Clarissa, who passed away at just 20 while hiking in France. They are calling for an urgent national screening committee to review and reconsider evidence supporting the rollout of a national screening programme, and for there to be a national screening strategy for the prevention of young, sudden cardiac death. I would greatly welcome the Minister's comment on this, particularly when a similar programme was introduced in Italy in the 80s. They've seen a reduction of young people dying by 85% in that point. Over the last year, I've been speaking to national sporting bodies alongside my colleague, the Honourable Friend for Beckenham and Penge, to identify who are already screening their players and how they do it, as well as meeting organisations that represent sports facilities. Just the other week, we heard excellent news that cardiac screening is being introduced across Netball Super League here in England as a requirement from next season, and every player will be screened before the season starts. I also understand they've been working with CRY to provide screenings to clubs and players where they don't have anything in place already. This comes after Caitlin Lawrence collapsed while warming up for a netball match, and after hospital scans showed she had an irregular heartbeat. Lawrence was asymptomatic, young, fit, and elite netball player, and her experience shows just how crucial it is to screen young people playing sport. I also want to be very clear, many people can still play sport upon receiving their diagnosis. We have wonderful tools available and fantastic cardiologists across the country to facilitate this. You only have to look at how successful Christian Erik's been since his collapse on the pitch during an international game. It's not a deterrent, it doesn't have to be, it's information, and it's simply not good enough to say that screening young people put them off sport and therefore should not be widely carried out. But crucially, a level of screening isn't being undertaken. That means we have to also make sure we have access to DFibs and understand how to carry out CPR, as these are just as important. The Honourable Member for Beckenham and Penge and I met with Arsenal's team doctor, Zafir Iqbal, at Arsenal's training ground earlier this month. Zach is incredibly passionate about cardiac care and has been using his position at Arsenal and at his previous clubs to champion greater awareness of CPR and DFibs among school-aged children. That's where I want to draw attention to the incredible work that Brentford FC is doing with their Heart of West London campaign, opening up their ground to offer cardiac screening to the surrounding community. They do about 1,000 a year. This kind of engagement is exactly why we need to get the message embedded into our communities of how important it is to be ready in the event of an emergency. But the matter that is our DFib network is nowhere near fit for purpose. I recently held a DFib dash in my constituency, which effectively worked on a small scale community audit of our DFib network, and the results were deeply concerning. The majority of consultants who took part had to dash for 8 minutes or longer to get to their nearest DFib. So as a reminder, Madam Deputy Speaker, for every minute CPR or DFib isn't used on an individual suffering from a cardiac arrest, their life expectancy falls by 10%.
On that point?
Of course.
Max Lawrence.
I'm very grateful to her for giving way. She's making a powerful speech, just as the Honourable Member for Harlow did earlier. In line with the question asked by my Honourable Friend for Bolton West, defibrillators, when they're rolled out to communities, can be incredibly useful for all the reasons that she stated. And across Leeds South West and Morley, it's very hard to find an area in my constituency where we don't have a defibrillator that's been fundraised and installed by volunteers. But I must admit, I don't know how to use one. There's a point of this debate, I'm going to go away and make sure I do know how to use one. But how do we roll out defibrillator training nationally to ensure that as many people know how to use them in an emergency as possible?
Amanda Hack.
I thank my honourable friend for making that really important intervention. Defibs talk to you. You don't need to be mystified by the use of them. They're really clever bits of kit. And a 999 emergency responder will talk you through that. It's really, please go and get trained. Honestly, it's really important stuff. Of course.
I'm really for bringing that forward, and Honourable Gentleman for his intervention. Across my constituency of Strangford and indeed across Northern Ireland, defibrillators have been supplied to every school, to every community centre. The local communities in Ards and Ballynahinch and down the Ards Peninsula have also got a defibrillator in their city centres and their village centres as well. But what we have is an organisation called First Responders, works in the Ards Peninsula. They're the ones who can very quickly do training every month for those who want to learn how to use a defibrillator. But also on the defibrillators that we have in Newton Ards and elsewhere, there's a small diagram, an ABC of how to use it. Now, I haven't had to do it, Madam Deputy Speaker, but I'm presuming I've been told by the first responder and others, you follow those 3 directions and you can use the defibrillator as good as anyone. That's what I've been told. Does the Honourable Lady have the same opinion?
I thank the Honourable Member for his intervention. I think the key thing that we've been trying to do in my constituency, and I'd encourage other members to do the same, is to demystify those yourself. There's some really easy tools online that can show you, but they're so clever. They're such clever bits of kit. Please don't be afraid of looking into that.
My honourable friend.
John Stringer.
I'm grateful to my honourable friend. Does she agree with me that the activities of charities such as the RJ Foundation in my constituency of Rugby are critically important in this issue as well? And Naomi Rees-Izzet created the RJ Foundation in memory of her son Jamie. And not only have they installed hundreds of defibrillators around Rugby and the surrounding area, including bleed kits, but they also hold, to her point, they also hold training sessions in the community with qualified paramedics and nurses giving the training. And I've attended one of those, and they are just as much lifesavers as the defibs that go into our communities, and that can also all help reduce these sudden cardiac deaths in young people.
I thank my honourable friend for that intervention. Madam Deputy Speaker, I think the conversation around defibs has been a really interesting one, but this is obviously just part of the solution when we're looking at cardiac risk in young people. I think the main point that I was trying to make is until we can roll out an effective programme of screening, we need to make sure we've got the tools in our toolkit around CPR and defibs to make sure we can support a person if they're going into cardiac arrest. I think just to finally to finish, the importance of CPR training, the importance of knowing where your nearest defib is all part of that solution. But actually, when we're looking at cardiac risk in young people, it's about actually how do we make sure that those individuals that are asymptomatic are screened and that information is made aware to them of how they can react if they have got an undiagnosed cardiac condition. I just wanted to put my record my thanks to CRY, the British Heart Foundation, Resus UK, Brentford FC, Arsenal FC, East Midlands Ambulance Service, and Kerry from Vitalise Health and First Aid Training, and all the bodies that have supported me in my questions around health screening, and of course the fantastic campaigners such as Hilary. Madam Deputy Speaker, the truth is we could be doing far more to tackle sudden cardiac death in young people. So why aren't we? I'd really love to hear from the Minister. Thank you.